The mission of the Zane Cohen Center is to build knowledge to improve patient care, focusing in on hereditary cancer and genetic, environmental, microbiological causes of inflammatory bowel disease, mainly Crohn's disease. We are very much a collaborative center in every aspect. We have physicians and surgeons, geneticists, pediatricians, pathologists working on the translational aspects of research, and we're all together. We're not scattered throughout the hospital or throughout other buildings.
The close interaction between our surgeons and our team of gastroenterologists is really what makes us unique. And we're able to share ideas, share approaches, and answer research questions that are overlapping between the surgical and the medical approaches. Our research floor is integrated with all of our students and fellows all working together in the same center.
I've been here for the last 7 months. In the last 7 months, I learned a lot of new clinical skills, how to handle very complicated IBD patients.
Our research, being very translational then, requires taking specimens and getting data from our patients when they're in the clinic. And we do that both in the surgical setting as well as in the medical setting. And inflammatory bowel disease is in fact a disease where the surgical approaches need to be interactive with the medical approaches. I'm involved in a number of translational research projects to tackle IBD. My research program looks at trying to get to the cause of IBD, and more recently what I've focused on then is the environmental side. So we do know there's a strong environmental component to IBD, and we believe that that environmental component involves the way the gut bacteria is composed and how it might be changed or altered by various environmental factors such as diet and nutritional aspects. In addition to focusing on the cause of inflammatory bowel disease, we're also very interested in the components that factor into what happens to patients with IBD. How can we prognosticate what is likely to happen to a patient with IBD?
Inflammatory bowel disease is a little bit of a unique disease in that both surgery and medical management play a role. We've done quite a few clinical trials to determine whether our treatments are effective. We've measured our surgical outcomes, and then more recently that we have focused on using the best practices based on best evidence to ensure that our patients are getting the best surgical care.
A lot of the research that we do at the Zane Cohen Center at Mount Sinai Hospital revolves around studies of endoscopic outcomes in patients with inflammatory bowel disease and digestive disorders. We are leaders in endoscopy by virtue of the fact that we do have a collaborative approach with respect to the interaction between the gastroenterologists and the surgeons, looking at not just their clinical outcomes and parameters, but also looking at endoscopic outcomes.
The most important clinical trial that we're doing now is the GEM study.
The GEM project that I lead out of Mount Sinai Hospital is really a multinational project that really focuses on trying to identify the cause of Crohn's disease. And in this study, we're doing something that is quite unique. We are actually studying people who are about to develop Crohn's. They're healthy, they have a risk of developing Crohn's because they're a sibling or an offspring of someone with the disease. And so by looking at them when they're healthy, and then when they develop disease, looking at them again, we're trying to understand what was that trigger. The GEM project will allow us to not just look at a patient and say they have Crohn's disease. Hopefully we'll be able to say that they have Crohn's disease because they may have a certain genetic problem. They may affect the way their immune response reacts to the bacteria in their gut. We now have at least 3 parameters against which we can see if a certain drug therapy will work or will not. So this is what I would say is a classic example of what is now referred to as personalized medicine.
I've now been a patient at Mount Sinai, I guess, for approximately just over 10 years, and during that time there's been ups and downs in my health. The experience has been fantastic. It's never a fun thing to have to deal with IBD, but it makes it that much easier when you're dealing with doctors and nurses and an institution that you feel understands the problems that you're going through.
The patient is central to what we do here.
The patient has a tremendous resource here of expert people that under one roof that they can maybe get individually in other centers, but I don't think they can get it all in one center.
I think we will get to the answer and help people eventually to eradicate this disease, and I think that is a foreseeable outcome in the next 10 years.